and thank you for joining us for the 49th Annual AAKP National Patient Meeting. We hope you have been enjoying the sessions. My name is Candie Gagne, and I'm a kidney transplant recipient from Pennsylvania. I have the honor of serving as a member of the AAK National Board of Directors and an AAKP ambassador. Being an AAKP board member and ambassador has allowed me to advocate for not only all kidney patients, but more specifically for veterans, which is where my heart is since I'm a veteran and a retired Navy hospital corpsman. As a proud member of AAKP, I firmly believe that every kidney patient's voice is paramount in determining their care plan. It is essential that we cultivate an environment that encourages kidney disease research and innovation, driving continuous advancements in care, improved treatments, and solutions for unmet patient needs. Once these innovations receive FDA approval, it is equally important that all patients have access to the right to choose treatment for them in consultation with their chosen healthcare team. This ensures every patient can live their best life and achieve their aspirations. As a fellow veteran, I'm proud to support AAKP's Veterans Health Initiative. AAKP launched the Veterans Health Initiative in 2017, which is chaired by AAKP President Ed Hickey, a retired Marine Corps veteran. The Veterans Health Initiative is based within the AAKP Center for Engagement and Advocacy and is designed to advance research, innovation, and policies aimed at safeguarding the highest standards in kidney care and treatment for veterans managing kidney disease, both inside and outside the VA medical system. Veterans and their families face many unique challenges relating to managing their health care, and this is especially true for veterans who suffer from kidney and other complex chronic diseases. AAKP is committed to ensuring fellow veterans have their voice heard, retain access to the care they have earned, and are legally entitled to do the VA and elsewhere, and benefit from new research and innovations in biologics, diagnostics, and devices. But AAKP knows we cannot do this alone. In 2023, AAKP announced its formal partnership with the United States Department of Veterans Affairs, which aims to improve health outcomes and enhance overall quality of life for veterans with kidney disease. AAKP also partners with Veterans Transplant Association, founded by AAKP Ambassador Durante Briggs, and Career Echo on supporting virtual career fairs that promote remote and hybrid employment opportunities for veterans, the disabled, and others. However, today we are pleased to have with us one of our very special allied partners lead our session. DOVE, a Veteran-Centric organization increasing access to kidney transplant and improving mental health and coping for veterans with chronic diseases. And it's my honor to welcome a valued friend and distinguished guest, Sharyn Kreitzer, founder and executive director of Donor Outreach for Veterans, or DOVE, and our 2024 recipient of AAKP's Medal of Excellence Award in the social work category. As an allied nonprofit organization, DOVE is dedicated to increasing transplant access for veterans. With a 26-year career, Ms. Kreitzer has extensive experience in dialysis, social work, transplant outreach, and living donor programs. Her innovative approaches have significantly increased transplant referrals and living donor rates. After serving as the administrator for the Bronx VA medical system, where she helped launch the 7th kidney transplant program in the VA system, Sharyn founded DOVE in 2020. Under her leadership, DOVE has screened over 1,100 prospective donors and facilitated transplants for 35 veterans. One of those individuals who was helped by DOVE is Army veteran Damon Hewin, who is currently a detective for the Auburn Police Department in Washington State. We are extremely fortunate to have John Postawa, a homicide detective with Auburn Police Department, who is not only a colleague of Damon's, but also a living donor. the one who donated his kidney to Damon. It's an honor to have both of them here to share their stories later in the session. First, I'd like to turn it over to Sharyn to kick off the session by sharing insights into the great work of Doug, and then hearing from Damon and John. Sharyn, take it away.
Thank you, Candie. It's such an honor to be here at the National AAKP meeting, and I'm really excited to share with your community more about DOVE and our work with veterans. DOVE stands for Donor Outreach for Veterans, and my talk's going to focus on how DOVE is a veteran-centric organization that has been helping increase access to kidney transplant, as well as improving the mental health and coping for veterans with kidney disease. I want to tell you a little bit about myself. I am the founder of DOVE. I launched DOVE in 2020. I have been a transplant professional my entire career. For the past 27 years, I've worked in the private sector. And then in 2015, I helped to launch a kidney transplant program in the VA system. 2 years ago, I became a living kidney donor. And I donated my kidney as part of another community organization, Renewal, that served as my mentor organization. And I'll talk a little bit more about that later. DOVE is a nonprofit 501c3. We do not charge veterans, nor do we charge transplant programs for participation. And the source of funding for DOVE has mostly been through individual donors, fundraisers, and corporate sponsorship. Currently, DOVE has a staff of 4. I am the only full-time staff member, and we thrive only because of our many volunteers. DOVE serves as a veterans champion. I know in the transplant world, we refer to kidney donor champions, where transplant programs encourage recipient candidates to find someone in their family to help campaign for the recipient's need to find a kidney donor. Well, I'm taking that successful concept a step further by being a champion for the veteran community. And our goal is to find, educate, and then match prospective donors to veterans who are actively waiting for a kidney transplant at any center throughout the country, and that they're waiting on the national UNOS waiting list. So we serve as a champion, and we treat the donors as VIPs. We support donors as they navigate the entire process, and we ensure that they find donation to be rewarding and that it is of no financial hardship for them. And this common sense, patient-centric, and communal approach is really making an impact. As of today, we have helped 46 veterans receive life-saving kidney transplants. Why focus on veterans? Well, first of all, when I started the transplant program in the VA, that's when I learned that kidney disease is more prominent within the veteran population compared to the civilian population. However, the rate of transplant in the VA and the military medical centers was lower compared to civilian centers, and the living donor rates were even lower than the deceased donor rates. So what that translates to is that veterans were dying at higher rates as they were waiting on the list for transplantation. And that I found was unacceptable. So I thought that there would be a wonderful opportunity, because as I was learning at the VA, I learned about the vast ecosystem of support that exists within the military and veteran community. And I saw that there would be many outlets to tap into that I could help spread awareness about the need of veterans who were waiting for life-saving transplants. And I might be able to tap into the community to find prospective donors. And the idea is, if people knew that there was a need for this specific community, I thought that having a connection to this community would make them learn more or be interested in learning more about kidney donation. And then once they learned and were interested, then I would help connect them to the veterans who were in need. There are over 2,000 veterans who are waiting for a kidney transplant in the United States. I know that there are at least 2,000 because I can do a report based on the VA transplant list and the Walter Reed transplant list. But obviously, there are many more veterans who are at the private civilian centers as well. But I thought 2,000 is what I continue to focus on because I thought that that really represents a large group of people who need, but not overwhelming. And the goal I have is to get to a zero wait list for veterans. Now I just want to play for you a video, which I think gives you a good overview of Dove through the eyes of Victor and Kim.
My name is Victor Daniel Marinez, and I am a United States Marine and also a Dove Team 19 transplant recipient. I learned I had kidney disease due to extreme hypertension. I was seeing a nephrologist, and he kind of prepared me for the inevitability that my kidneys would eventually fail. Waiting for a kidney donation is pretty tough. The pain that I experienced throughout that time probably didn't amount to what I was going through emotionally and mentally.
My name is Kim, and I am a high school principal. I was listening to a radio show all about donating kidneys through this organization called Dove, and we having a strong connection as well to the Marines and to the military through my own son's service. I just knew it was something I wanted to do.
I didn't know Kim's name. I didn't know anything about her. I just knew that someone came forward to save my life.
Victor and we were able to meet while we were still in the hospital. It was one of those speechless moments that you just look at each other and we just both knew and we were connected. It takes only meeting somebody who's either waiting for a kidney or has received a kidney through Dove to know that it's something that you want to do in whatever capacity you can do it.
Whether it's donating, financially or, donating time or even donating an organ, somebody out there needs the help.
Thank you. You guys saved my life, and I know I appreciate it, and my family does too.
I wanted to just quickly put a slide up and show how Dove works, and it's really quite simple and straightforward. If a veteran is interested in partnering with us and having us help in their campaign to find a donor, they complete a brief intake on our website. They will be linked with one of our case managers, and they need to, before we can move forward, we need to confirm that they are listed actively at a transplant center. So not in the process of being listed, but listed. And they show their proof of military service, the DD-214. When they confirm that they have those two pieces of information, then they are scheduled very quickly with a case manager for a video meeting, and we discuss how Dove works. And we encourage them to develop a profile that will be on our website, but each profile also serves as a unique URL link so they could use it for their own individual outreach. And we provide all kinds of tools and kits and information on how to share that profile within their community and how to find champions still within their community as well that can share their profile and their information. We also have mentors that are available to support veterans and caregivers that are available to support veterans' caregivers. We then keep in touch with our veterans who are waiting with monthly check-in meetings where we just update each other on progress. We strategize when there are timely things that are going on in the calendar, like Veterans Day or July 4th, or any opportunity where we can have kind of a fresh perspective and try to get the Dove story out there or their patient profiles out there to look at new eyes. When they do have a transplant scheduled or have found a donor that's cleared, we support them and we follow them very closely throughout the whole planning process. And then we also support them after the transplant and hope to stay in touch with them long after the transplant. For sure, we touch base for the yearly kidneyversaries. And then we try to encourage those who want to continue to participate in events and other activities that we facilitate. As far as the kidney donors go, they may respond either to a media campaign or to an individual story, or they may just find us on the website and they connect us similarly to the veteran. They're going to click on a link. They are given the opportunity to schedule immediately with one of our donor case managers. And what we do in that initial meeting is we provide an overview of what's involved with kidney donation, so we can prepare them for what's involved and give them the education that they need to decide if they want to move forward with a more formal evaluation. We then link them to a veteran, and that's triage in a lot of different ways. Basically, they're given the link to the Veterans Transplant program to the donor side, and they go through the evaluation as per normal for that program. And we really only are involved during that point of time to the donor as they have questions or as they need support. There is oftentimes a need for us to get involved with case management because donors have out-of-pocket expenses such as travel. They have concerns about, lost income from work or childcare. And so as an organization, we really do try to support each individual need and make sure that we can make sure that it's financially neutral for them to donate. Once and if they're cleared for donation, we support them as well in the planning process and during or after the transplant. And we are often very connected to our donors, and we touch base regularly and definitely yearly to just check in and see how everyone's doing. How Dove involvement helps increase access to living kidney donation? Well, from what I just explained before, we really help just give veterans and their family the tools that they need to get the word out there that there's a need and to help them with the ask, and then to filter the donors that come in on their behalf. The successful campaigns can generate an overflow of cleared donors. And so there's a communal aspect to this as well, which is very rewarding for veterans, where if they've had more than a few donors or more get cleared, it's not uncommon for a donor to say, now that I've learned about donation and now that I've learned about what Dove does, I'd love to help another veteran. And so that one campaign can turn into several other veterans getting a transplant, which I know is incredibly rewarding to the veterans. And, you're going to meet Damon, who can share that this happened for him, and his campaign generated another donor for another veteran as well. Also, our national media exposure is going to help increase awareness for each veteran who's on our website and potentially get them a match from a person from across the country. And, again, I can't understate the impact of our intervention and support with the donors, because unfortunately, the kidney donor evaluation is not always easy for donors, and they have a lot of concerns about the process, or there's a lack of communication with the team, or there's a lack of supportive resources for the donors. And we're there literally 24/7 if a donor needs us. And I think that kind of consistent, kind customer service attention really enables a donor to feel good about moving forward, and has had a huge impact on ensuring that a donor kind of is able to complete the whole process. Here are some examples of some media that we've been privileged to have over the years, and that have generated many, many inquiries to our program and has saved the lives of many. So you are going to have the pleasure to meet John and Damon soon. So I put their story that was profiled in 2021. Really, them being willing to share their story led to a lot of these other stories that came thereafter. Their local stories were picked up nationally. The national news, once they covered us, Dove just kind of exploded from that point. So I really feel John and Damon are a huge part of Dove's growth and success. And I'm forever grateful to them. And I wanted to just mention, even though this wasn't, the main goal of Dove wasn't to show that we could positively impact a veteran's mental health and coping, but it's an obvious outcome of our program that has been tremendously rewarding. We've really cultivated a community and a family where, most of our 46 transplants were still very connected to the donors and the recipients, and they all want to give back. Now, it would be perfectly fine for the veteran who received to just live a wonderful life and not feel inclined to come back and serve Dove, but that's not the way they work. They want to keep helping. And I think it's just been beautiful to see. The communal aspect of Dove is the antidote to isolation. When anyone is diagnosed with chronic kidney disease or veterans, they have shared many times that they've kind of kept it to themselves. They've isolated themselves from their family, from their colleagues, from their communities, because they did not want to share their vulnerability or their feelings or feeling dependent or needing help. And so that is not good for emotional well-being. But Dove really counters that because we have these regular groups. We give the tools to the veterans. We make it okay to ask for help, and we let them know that by them contributing to Dove is contributing not only to their own good outcomes, but to other veterans. And that really is what engages them. And then we have continuous event participation opportunities, both in remote and in person. And we really encourage connection between veterans and mentorships, because I think that there's an authentic bond between a veteran. They know how to speak to each other. And then a veteran who has kidney disease, I just think there's something that they can understand with each other that an outside person can't. And that is very impactful. I think it also impacts veterans positively that the very existence of Dove is kind of a thank you for your service. I don't come from a military background, but it makes me tremendously proud that I am using the skill set I have to help strengthen and support veterans and their well-being. And many people feel that way. So while many who support Dove are from the military communities, many are not. And it's just the public that wants to give back. And I think that touches many of the veterans' hearts deeply to know that they have this impact on the general public. And there's an example of these gift packages that we've done. There's a corporate partner we have, and their employees wanted to just send notes and care packages to veterans who have not yet received a kidney and let them know how much they appreciate their service and that they are praying for them while they wait. These are just a quick examples of the many events that we do throughout the year. I encourage anyone to visit our website and participate in any events that we post. We love to have you visit us or contribute in any way. This, I think, I want to leave with the quote from one of our recent veteran recipients who wrote a lovely note to us and really just talked about how Dove tremendously raised his spirits and his hope. Where he said there was uncertainty, Dove has brought hope and the promise of a new life. And that just means the world to me and to the success and future of Dove. And this is Amanda, who's one of our kidney donors as well. And here's the information how to support us. Follow us on the social media handles, visit our website, check out our events, help us with fundraising. And I appreciate your time listening to this talk about Dove. I now have the tremendous honor of introducing you to John Postawa and Damon Hewin, who I've referred to and showed you pictures of. They are officially Team 3. So they are at their 3-year, just past their 3-year kidneyversary. And we're part of Dove's growth and success. And I hand it over to them to talk about their experience with donation and with being a recipient.
Hi, so I'm Damon. I think like some of the things Sharyn said with the mental health aspect of going through having kidney disease and waiting for a transplant, I had a lot of people around me, but other than family support, I really kind of felt isolated. I think my boss at the time knew that I had kidney disease. He would always tell me that his sister had it, but very few other people in the building knew. So when it was time to get put on the list here for a donation, I really had no idea where to turn. My wife was the same blood type, and we were at University of Washington, and she was going to she wanted to be considered for a donation, and that process was not very pleasant. I went for one meeting and one appointment, and I never heard back from them again. My wife made multiple calls, and we never got any response back. So with my background being military and now a police officer, it's real easy for me to want to help others. It's just kind of the nature of who you are as a person in that field. So, but it's also really hard to ask and seek help for yourself. So it's essentially like going to work, go home, start dialysis, wake up the next day and do it again. And people around me, you couldn't tell, because I came to work and did my job, never slacked off. But no one knew what I was dealing with at home alone. And even though I had my wife and my kids, still felt like I'm dealing with this by myself, just sitting and waiting for who knows how many years for a deceased donor. And then I got one day, I get a call from the kidney center at Walter Reed, and they told me about Sharyn and this new Dove program. And the first thing I did was I called right away. And it was just perfect timing, because I was ready to go. That process, Sharyn did everything she did. We created social media links, and I know there was different things like the Military Times newspapers. And I know I end up hearing later, a lot of my veteran Army buddies came forward, and I started getting all these phone calls like, dude, why didn't you ever tell us anything? And one of my friends was also going through the process to be considered a donor. There was another colleague who she told me that she was actually being tested to be a donor. She ended up not being a great match, but she also was part of Team 4 and donated to a Navy veteran. And I just always say that God works in mysterious ways, because I leave the Army, I come to Auburn Police Department, knowing that at some point in my life I'm going to get a kidney transplant. And who knew? Had no clue that John had saw any of that, and started going through the process to see if he could be a donor. And as fate or luck or would have it, here the person ends up being my donor. It's literally down the hall. So, and I would have never even thought to tell anyone in the police department, like, hey, I need a kidney. Anybody feel like donating? So that was real awesome to have that happen, and still so close to home. And what I was expecting of a 5 to 7 year wait for a deceased donor, I ended up having a new kidney in 6 months.
Yeah, so I'm John, I'm the other half of Team 3. I'm privileged to represent Sharyn's a great person, does a great organization. I became a donor. It's kind of a cool story. Damon and I had worked for the same department, but we really never knew each other. We worked different units within the police department. Never worked the road together. Never really worked any cases together. We just kind of knew each other. But through social media, everybody is kind of friends with spouses and other department members. So one day I'm just kind of scrolling through social media, and I see the Dove campaign for Damon. And just like he was describing, it's like, what the heck? Like, nobody knew he was this sick. So I reached out to Sharyn, had a couple of conversations with Sharyn. She just explained the program to me, and it took me a couple of months to get fully committed with schedules and stuff like that to where it was like, no question, I'm going to do this. So I went through the testing program, or the process, first locally, and then I flew out to Walter Reed for a day full of testing. And then I think it was just a few days after that full day of testing that Vilda from Walter Reed had called to say that I was matched for Damon. So my wife and I, got to tell them in person that I was a donor.
Yeah, that was a really great time to. I started hearing a little bit that I knew John was being tested at that time, and I started hearing a little bit that he might need a match. And then one day he's like, "Hey, can we come by?" And I'm like, "Okay, sure." So to get that news with my wife there, my kids there, yeah, just say that the tears were flowing. Everyone was happy because, like, I was just going to keep going, doing what I was doing with, if I get a kidney one day, it would obviously be great. But to have that, and just like the other Marine said, it literally saved my life. So just gave me a new lease on life going forward from there, which is super important to me because I got young kids and wanted to be there and see their lives just grow. And now I can do that thanks to John and Sharyn. Because I would have, if not for that call from Vilda, I would have never heard of Dove. Funny story about that, I think the first call I got from Vilda was probably maybe spring of 2000 or 2020. And I talked to Sharyn then. I got all the information to put together the social media packet, and it's around the COVID times, and so pandemic times. So I just kind of set it aside, felt like, okay, I'm fine. And then I ended up having to go to the doctor in November because there was an issue with my PE catheter. And then the doctors at that point was like, you need a transplant now. And I'm like, let me go find that number for that Sharyn lady. And it ended up being just perfect timing. So I'm forever grateful and thankful for Sharyn and John.
Sharyn, Damon, and John, thank you for an incredible presentation and sharing your personal journeys. Before we conclude, I'd like to ask each of you a few questions. Sharyn, can you discuss some of the partnership and collaboration between Dove and other organizations to enhance the support provided to veterans?
Sure. Well, I have to start with the Renewal organization. I had mentioned that on my introduction to my talk, where I showed a photo of myself with a member from the Renewal organization. Renewal is I think they founded the idea of community-directed donation, and they're tremendously successful and supportive. And they've been able to facilitate over 1,500 living donors within their religious community. And they have served as cheerleaders, mentors, guides for Dove. I've known them throughout my career, and I'm enormously grateful for them providing the template for Dove and support to launch it. And that's why I donated my kidney to someone in the Renewal community as a way to say thank you to them. But they also gave back because a member of their community donated to a veteran in return. So we did a swap. And it's symbolic because I believe that community-directed donation can end the wait for everyone. And if communities rally behind members of their communities that are in need and we all share resources, we can remedy the shortage. The other organizations obviously would be the vast amount of veteran organizations, whether they're VSOs, whether they're government entities focused on veteran policies, veteran-owned businesses, veteran employee resource groups of corporations. There are so many levels and layers of organizations that I uncover each day and that I try to tap into to not only raise awareness about what Dove is about so they can refer Dove as a resource to veterans who need us, but also obviously to inspire someone to consider being an organ donor who otherwise wouldn't have if they didn't know that they could help a veteran in their community or in the community. And then American Association of Kidney Patients and other nonprofits that support those patients, programs who treat those with kidney disease. You've been a partner and a supporter and have launched the Veteran-Centric initiative. So I'm excited to partner with AAKP and help strengthen policy that increase access to transplant for veterans.
Sharyn, what role does peer support and mentorship play in Dove's programs?
I mean, it's like I said, it's not something that I knew was going to be as powerful as it's become, but it's everything. I think, like Damon said, it's difficult for anyone to ask for help or an organ from someone else, but particularly for those who serve and have served the country, and that's their mindset. And so for them to speak to other people who know exactly what they've been through and to connect on that level and talk through things means everything. And then also to be able to continue to serve by supporting Dove in the mission and helping other veterans is very important psychologically to them coping as well. So just staying connected to the community, continuing to be in service to others in this way, I think is very impactful and meaningful.
And finally, as Dove continues to grow, what are the goals for expanding the program and reaching more veterans in need of a kidney care and support?
Well, I've proven that this concept works, and that was what I sought out to do when I left my career in working in hospital settings. I kind of took a risk and I launched a nonprofit. I didn't know a lot of what I was doing. I didn't have any money backing it. I just knew that I wanted to show that this would work. And I think I've shown that this works. So now the goal is to get the funding that I need to scale this. And my ultimate goal is to have a zero wait list for veterans and to inspire other organizations, other communities to follow Dove's lead, like Dove followed Renewal's lead, and to just work collaboratively to find a kidney for everybody who needs one.
Thank you, Sharyn. Turning things over to Damon and John. Damon, how did the Dove Foundation address your mental health and emotional needs during this journey, and why was this important to you?
I think Dove addressed my mental health and emotional needs just by offering support and taking the weight of the world off my shoulders with helping finding a donor. I think a lot of kidney patients go through a lot of isolation and depression. One of the worst things I've ever seen was going into the dialysis centers and you see people and they're going through their hemodialysis, and it looks very depressing. And to think that, man, that could be me one day. But to have Dove come along and to bring me away from that, so not only to bring me closer to the people that I work with, created this bigger community of other folks who've gone through a kidney transplant. So it just brings you closer to other people that are going through the same things that you are going through, so you don't feel so alone and dealing with it by yourself.
John, what were some of the concerns or fears going into the donation process, and how did Dove help address them?
Initially, I think my concerns were pretty broad. I had no idea what being a kidney donor would be like or what was involved in it. So it was those initial conversations with Sharyn, and she answered most of the questions, and some of the questions she couldn't answer. But she has a great network of resources. So She put me directly in touch with nephrologists that are experts in their field. And if they didn't know, they'd refer me to somebody else, whether it was online resources or directly with other professionals in that community. So I felt very comfortable. And some of the questions that weren't answered were like from my primary care providers who they didn't know the answers to. And I could call Sharyn and she would point me in the right direction. So Dove, they don't have all the answers, but they know where to go. So that was a huge resource.
And we've heard from a lot of people, John, that there's been a rewarding aspect of being a kidney donor. And how was that impacted your life?
It's very rewarding to see, talking with Damon today, and we talk often about this. I get emotional just telling the story about the experience. Knowing that, his misery of being on dialysis 7 days a week. I went into one of the dialysis centers at Walter Reed, and I saw the environment there, and it's not a pleasant experience. And I was able to at least alleviate that from Damon. And then telling the story about my experience has hopefully brought other people to donate and be part of that. And just changing me. Obviously, I'm a little sensitive about it now. I get emotional telling the story. I haven't always been like that. So just kind of grounding me and making me, more able to talk about stuff like this and reminding people to ask for help when they need help and not just be, these alpha types that we're willing to help, but we don't ask for help. So just telling the story has helped me kind of ground myself and I think be a better person just in general.
And Damon, what advice would you give to other veterans who are on the transplant waiting list or consider reaching out to Dove for help?
Don't hesitate, get up and do it. You might be feeling like there's no help out there, or you just got to do this. Don't suffer in silence. Reach out to someone, reach out to Dove. I know I've even referred another, one of my leaders in the Army is dealing with kidney issues, and I told him forever to get in touch with Sharyn. So just as easy as as eager as we are to get out and go help someone, take a moment and do something for yourself.
Damon, looking back, is there a specific moment or aspect of your experience with Dove that stands out as particularly meaningful?
Yeah, for me, that moment that John and his wife came to the house and told my family that they were going to be the donors, it really brought our two families together at that moment. So our wives are our friends and are close with each other, and we're still close with each other 3 years later. So that was the big significant thing, is to be told that, hey, I'm gonna do this for you. This is gonna save your life, and I'm not asking for anything in return.
And John, what advice would you give to others who are considering becoming a donor, especially within the context of helping veterans?
I would suggest, and I've told people, have a conversation. If you ask around, you probably know somebody that has kidney disease and needs some help, and just have that conversation, find out what it would mean to them if you were a donor. Do online research and find out what it really entails. I don't really regret anything that happened at all with the process. For me, it was an easy process. And I think not knowing is that biggest hurdle to get through for somebody that wants to help. So just have that conversation with somebody, even if it's one of the organizations, Dove, AAKP, do some research, have a conversation with somebody that it might impact, and that'll help with the decision.
Sharyn, Damon, and John, on behalf of AAKP, I'd like to extend our heartfelt thank you for joining us today and delivering such a valuable and inspirational presentation.